Malloy administration proposal to save $100 million came under some harsh criticism at the state capitol today.
Advocates for the needy say the savings will never be realized and many people would end up with no health coverage.
Our chief political correspondent Mark Davis live to sort out what the two sides are saying. Mark?
Hi, Darren and Sonia. Good evening, everyone, from the Hartford newsroom. Connecticut's Department of Social Services is involved in the lives of approximately 700,000 Connecticut residents. The governor wants to make some small changes to just one of their programs.
Leave us alone, let us live in peace, and help us get through what we're trying to get through, okay? Thank you.
State lawmakers got an earful today from some of the estimated 70 to 80,000 state residents that participate in the low-income adult assistance program through Medicaid. Designed as health care for single adults who have no more than $512 a month in income. The Malloy administration, in an effort to save $100 million over the next 18 months, is seeking to kick people off this assistance if it can be proven they have more than $10,000 in assets beyond a home and one car. Advocates for the poor say it will never save that much money.
People who are living on such low incomes, they don't have any savings, because if they did, they would have used it up to live on.
The commissioner of the Department of Social Services admitted that through this and other programs, it handles about 5 million pieces of paper a month. Those on the program said today that many have been disqualified because the DSS simply loses the current paperwork and would never be able to handle this added red tape.
In reviewing past documents, I realized that each June for the past 3 years, my paperwork was lost and therefore not received.
To impose more eligibility criteria would burden DSS and make it even more dysfunctional than it already is, if that's possible.
The commissioner listened and said today that his agency can handle the paperwork and transition people to other programs in a compassionate way.
I know how it is to live without, and I also am very concerned about the impact of our programs on everyone.
Now, the proposal would also include using the assets of a parent and their income in determining the eligibility of young people aged 19 to 26. And many say today that that would force a lot of them off of any kind of health care at all. Live from the Hartford newsroom, Mark Davis, News 8.